Hi, in this video we are going to discuss about the reproductive health and the related problems and strategies on the reproductive health of the society. So in our previous video we have already discussed some of the aspects of reproduction related to the reproduction, and some of the problems and some of the strategies which were formulated by some of the governmental and non-governmental agencies, as well as the currently running action plans and programs, because of which several thousand times improvement is seen in the society. So for the successful implementation of all these action plans and programs, for the reproductive health requirement, the main thing is the availability of professional expertise, proper structural infrastructure, and along with that, the most important requirement is of the material events also. For successful implementation of these all action programs, these are all required. That is, improved structural infrastructure, along with that professional expertise, and along with that is the material things. These all are actually required for giving proper medical assistance and care for the people who are suffering from some reproductive related problems. These all type of things are actually required for the successful implementation of the action plans which are running in India for improving the reproductive health. So these programs actually emphasize on providing proper medical assistance. This is actually for providing proper medical assistance and care for people who are suffering from some type of reproductive related problems, which includes pregnancy, delivery, abortions, contraception, infertility, etc. So all these are some problems for providing proper medical assistance and care, these type of improved structural infrastructure along with that professional expertise and material things are highly required for improving the reproductive health in a society. So besides this, by providing all these type of things, the main thing is improved techniques, or we can say that the implementation of the better techniques and new strategies from time to time is also required for improving the reproductive health of the society. In our previous video, as we have discussed that for giving proper awareness, the first thing is to give information about each and everything which is related to the reproduction related aspect. If we are talking about the reproductive health, then each and every individual should know that what are actually the problems related to that, and to get rid of that, to give proper information is very much necessary. So these type of things, that is medical assistance and care, is very much important. Nowadays, as people are becoming more aware, governmental and non-governmental agencies are simultaneously working on different type of researches which actually works in the areas which is related to the reproductive health problems. Like one of the contraceptive pills which is called as Saheli. It was actually found out by the scientists of CDRI, that is Central Drug Research Institute, which is situated in Lucknow. So by the work and the research of the scientists who are working there, they had found out this oral contraceptive pill, which acts as a contraceptive which is used by the females. So here we can see that nowadays increased number of deliveries in the hospitals and postnatal care of the mother as well as the infant, it decreases the mortality rate, that is the death rate of the mother and the child, because of giving proper care to the reproductive health of the mother before and after the delivery is very much important. So all these are different types of things which is going on the way for increasing the reproductive health of the society. Some of the bans which is associated with the amniocentesis, like some of the statutory bans are on amniocentesis. Amniocentesis actually it is the test for sex determination. Amniocentesis, it is the test for sex determination in which the amniotic fluid, the chromosomal pattern of the amniotic fluid is studied, which surrounds the developing embryo. So by studying the chromosomal pattern, one is able to find out the sex of the baby, and it is illegal. It is legal in case if there is any kind of disorder, but it is illegal in finding out the sex of the developing fetus. So by creating these type of bans, it had improved the female feticidal deaths in India, and now the ratio of the male and the females are somewhat nearly equal. So here we can see that how by developing these type of aspects, and besides this, the families are nowadays small by the couples, by the population explosion is not going on their rapid rate, it is also very much less. So these, by seeing all these things, we can easily conclude that the reproductive health of the society is now consistently increasing. How it is increasing? By proper medical assessment and the proper medical care for the sex related problems and the reproductive health. So for all this, by giving proper medical assistance and care, the reproductive health of the society is increased up to maximum level. So this is all about this video. In our next video, we will discuss something more related to the reproductive health of the society. So for more